Good morning everyone. I am Shweta Singh, Assistant Professor, School of Pharmacy, BBD University, Lucknow. Today I am going to give a presentation on the topic mechanism of drug action. A drug may produce its effects by a number of mechanisms like combination with enzymes, cell membranes or other components of a cell. The action either be physical, chemical and classified at 4 levels. At molecular level, receptors, ion channels, enzymes, carrier molecule. At cellular level, transduction, for example G proteins, ion channel enzyme, and tissue level, contraction, secretion, metabolic activity, proliferation system, CNS and CVS, central nervous system and cardiovascular systems. Most drugs act by altering the various body control systems which may be receptors, enzymes or ion channels. Drugs act by their physical or chemical properties. Some of examples are bulk laxative, physical mass, dimethicone, physical form opacity, PABA, absorption of UV rays, activated charcoal, adsorptive property, mannitol and magnesium sulfate, osmotic activity, potassium permanganate, oxidizing property, antacids works at neutralization of gastric activity. In physical mechanism, when the drug does not produce any chemical reaction or change in the cells of the body and the effect is only physical, the mechanism involved are called physical mechanism, and these includes local application, physically acting antacids and bulk forming purgatives. Local application, emollients, counter irritants, massager pastes. Physically acting antacids, milk, mucin. Bulk forming purgatives, bran, isabgula, magnesium sulfates. Majority of drug interact with target biomolecules, usually a protein, enzymes, ion channels, transporters and receptors. By enzymes, drug enzyme interaction is similar to drug receptors interaction. The drug resemble the natural substrate, bind enzymes and cause the change in their activity. This may take place by activation of enzyme and by inhibition of enzyme. And the combination of drug with the enzyme may be competitive or non-competitive. Enzyme stimulation, unusual with foreign substances, occur with endogenous ones. Adenylyl cyclase, pyridoxine as a cofactor decarboxylase, stimulation affinity for substrate, and in enzyme induction, synthesis of more enzymes means the more protein activity. Enzyme inhibitions classified as non-specific and specific. In non-specific, denaturing proteins, altering tertiary structure of proteins, heavy metal salts, strong acids, phenols, alkalis, too damaging for systemic use. In a specific enzyme inhibition, competitive or equilibrium type, non-competitive, reversible and irreversible. By ion channels, ion selective channels transmembrane signaling and regulates intracellular ionic compositions. Specific receptors, ligand-gated ion channels and G protein coupled receptors directly binding to the ion channel and modulating or stimulating opening and closing of the channels. Transporters. Transporters are substrate translocated across the cell membrane by binding to specific transporters. These transporters facilitate diffusion, concentration gradient, pump against the concentration gradient using the metabolic energy, and drugs direct interactions with the solute carrier class of transporters proteins and work as an inhibition. Receptors. Receptors are a macromolecule or binding site located on the surface or inside the effector cell that serve to recognize the signal molecule drug and initiate the response to it, but itself has no other function. Receptors. The term agonist and antagonist is based on affinity and intrinsic activity. Affinity is tendency to occupy the receptors and intrinsic activity is the ability to initiate the changes which leading to the effect. Agonist, drug having both affinity as well as intrinsic activity, whereas antagonist, drug having affinity but no intrinsic activity. Example of agonist, acetylcholine at muscarinic and nicotinic receptors. Example of antagonist, atropine at muscarinic receptors. Partial agonist, drug having affinity but weak intrinsic activity. Example, nalorphine at opioid receptor. Inverse agonist, drug having both affinity as well as intrinsic activity but in a opposite direction to the agonist. Example, beta-carbolene at benzodiazepine receptor. The largest number of drug act through them control effectors, cell membrane, cytosol, endogenous substances and drugs, and these receptors regulate cell functions by altering the enzyme activity, permeability to ions, conformational features, genetic materials. The recognition molecule and receptors for specific ligands. These receptors transmit the signals ligand to protein in cell membrane and within the cell amplify the original signal, that is also known as cascade effect. Inactive receptors, when ligand is bound with inactive receptors, work as active receptors after the post-receptor events. Selectivity, affinity, efficacy. Selectivity of receptors, binding of drug to receptors depend on the physiochemical structure. Affinity of receptors, strength of binding between the drug and receptors. Efficacy or intrinsic activity, ability of a drug to elicit pharmacological response after its interactions with the receptors. Agonist, drug which initiates pharmacological action after binding to the receptors, similar to the natural hormone transmitters. High affinity and intrinsic activity. Value rests on greater capacity to resist degradation and act for longer than the endogenous ligands. Bronchodilation, salbutamol, it's much greater than adrenaline. Receptors, inverse agonist, an agent which activates a receptors to produce an effect in the opposite direction to that of the agonist. Beta-carbolines, benzodiazepine receptors in a central nervous system stimulation, anxiety, increased muscle tone and convulsions. Antagonist, an agent which prevents the action of an agonist on a receptors or the subsequent response but does not have any effect of its own. Having the same affinity for the receptors and similar to agonist and having poor intrinsic activity. Agonist, antagonist. Agonist, drug that occupy receptors and activate them. Antagonist, drug that occupy receptors but do not activate them. Antagonist block receptors activation by agonist. When agonist alone work with receptors, the full activation. When agonist plus antagonist, less activation, and when agonist alone work with receptors, there is a no activation. Partial agonist, an agent which activates the receptors to produce submaximal effect but antagonizes the action of a full agonist. Partial agonist affinity equals to or less than agonist and less having the less intrinsic activity. Opioid drugs, agonist or partial agonist on some receptors, antagonist on other. Pentazocine and nalbuphine agonist on K receptors, antagonist on gamma. Beta blockers, pindolol and oxyprenol, partial agonist, propranolol, pure antagonist. Exercise tachycardia may be abolished by both type, but resting here rate is lower with propranolol. Ligands, any molecule which act selectively to particular receptor sites. Affinity, binding without regard to functional change. Agonist and competitive antagonist ligands. Multiple receptor types and subtypes, dopamine 2, histamine 3, acetylcholine and adrenaline. Receptors regulation, density and efficacy regulated by level of ongoing activity of receptor, feedback from on signal output and other physiopathological influences. Receptor regulation in down regulation, continued exposure to a drug agonist, blunted response, desensitization, refractoriness or tolerance. Decrease affinity to drug and number of receptors Repeated administration, adrenergic agonist in asthma regulates the beta receptors. Upregulations, depletion of noradrenaline, treatment with adrenergic antagonist, supersensitivity of tissue to noradrenaline and in receptors number, sudden withdrawal of beta blocker in ischemic heart disease, susceptible to effect of circulating noradrenaline, arrhythmias. Nature of receptors. Physiological nature of receptors: works as transmitters, autocoids, hormones. For example, cholinergic, adrenergic, histaminergic, and leukotrienes, steroids, insulin. Drug: no known physiological ligands. Example: benzodiazepine, sulfonylurea, cannabinoid receptors. Receptors are made up of protein that transmit the signals. Receptors population inside and out the surface of the cell is dynamic and it changes with the environment and the ligand and is under constant control of the cell. Classification of receptors, pharmacological criteria, relative potencies of agonist and antagonist, classical and oldest direct clinical bearing, cholinergic, adrenergic and histaminergic receptors, tissue distribution, subtypes, cardiac beta receptors, beta 1 and bronchial beta 2. Ligand binding, measurement of specific binding of high affinity radio-labeled ligand to cellular fragments in vitro and displacement by selective agonist or antagonist. 5 ST receptors distinguish or differentiate. Transducer pathway, mechanism through which activation is linked to the response. G proteins, beta adrenergic, cyclic AMP, alpha adrenergic, IP3 DAC pathway and cyclic AMP, GABA ligand gated chlorine channel. Classification of receptors in molecular cloning, receptors protein clone, amino acids and 3D structure worked out, subtypes, sequence homology, doubtful functional significance. Thank you.